work with healthy elderly persons in their communities. Dr. Zaina mentioned it might be at the home, their communities. Also, gerontological nurses work with the acutely ill elderly who require hospitalization and treatment. Also, nurses can work with chronically or disabled elderly in long-term facilities or who need rehabilitation. So the scope of gerontological practice is working with adults from the time of old age until death. So it is broader scope. Now, yeah. What is that appearance now?
Slide not change.
Sorry, I will stop sharing and I will share it again. Now
you are.
No.
Only you. Present on.
is it moving now? Can you see? Type of examination and be certified as geriatric nursing or gerontological nursing, even though this is standard. We know that the standard they reflect the level and expectation of care as desired, and also they serve as a tool for evaluation. So the ANA specify and specify six standards. And I think we have to know these standards. So standard 1 is related to assessment. So there are gerontological nurse
अभी डॉक्टर रईस एक्सक्यूज लेंगे इसको
in order to identify the
गाड़ी में फिर यही पूछेंगे
situation of the elderly.
मैं तो आगे बैठा हूँ
Standard 2 is about diagnosis. So the gerontological nurse can analyze the assessment data in order to identify the diagnosis for patient. Standard 3 is the outcome identification. Standard 4 is the planning. Standard 5 is the implementation, and here we have several classification. So the first one is coordination of care. So the gerontological nurse should coordinate the care delivery for the elderly people. Also, health teaching and health promotion. So the gerontological nurse should employ strategies to promote health and safe environment. Standard 5C is regarding consultation, and consultation is applicable for more advanced rules, يعني above BSL. Standard 5B is about authority and the treatment, and the standard 6 is about evaluation. So the gerontological nurse should evaluate the older adult progress toward achieving the expected outcomes. And here I want to talk about the competencies. Again, Dr. Zaina, at the beginning of the symposium, she focused on the cultural competencies. Here I want to elaborate more on the general competencies that should be available among gerontological nurses. The gerontological nurse, they should have the ability to differentiate normal from abnormal findings in the older adult. They have to assess the older adult physical, emotional, mental, social, and spiritual status and function. They should have the ability to engage the older adult in all aspects of care to the maximum extent possible. They should have the ability to provide information and education
नोट कर रहे हैं स्लाइड बड़ा होना
and the language appropriate to the individual.
तो उनको बोल दीजिएगा ना ये स्लाइड मैडम को ये हम नोट कर रहे हैं तो फिर इस तरह हमें नजर नहीं आ रहे हाँ
Also, they should have the ability to identify and reduce risk, to empower the older adult to exercise maximum decision making, to assist the older adults in evaluating, deciding, locating any resources, and also they should have the ability to advocate and to protect the rights of older persons, and also to facilitate discussion of advanced suites. If we were to discuss the geriatric nursing rule, most of geriatric nurse rule could be as healer, educator, innovator,
उनको
advocate,
बोले स्लाइड पे ले
and
जाए ना तो
And here I want to discuss this issue.
उन्होंने करना है वहाँ पर वो
first
जाएंगे
I
ना
want to see the results. What do you think?
Slide.
As we prepare the next generation of nurses to meet the needs of our rapidly aging population, which of these areas should be the top priority
उनका मायर
in
माउस पे कहाँ
geriatric or
घूम
geriatrological nursing education? What do you think? I think we do not have the time to answer this question or to discuss it, but at least we can think on this aspect later. So what do you think the priority thing should be? Increasing the course work and clinical rotation, or prioritizing the curriculum in preventive care, or emphasizing disciplinary training, or incorporating more hands-on training with caregiving skills. So we can start thinking in this question. I will be happy to answer any of your question.
शुक्र है देखिए वो साइड हमें बहुत अच्छा लगा अभी हम समझ गए स्कूल को क्यों अच्छा लगा
Thank you, Dr. A good picture of what is actually the scope of the event. And we really, I hope that ensure that the person who are sitting there, they have learned a lot from your the science presentation and give a kind of overview of that what kind of scope we are having for the geriatric. Thanks a lot.
ये पंखों
Thank
के
you so
कितने
much.
खराब होंगे
Thank you.
अच्छा
While we are preparing the geriatric nursing curriculum. Actually, geriatric nursing curriculum is already added in our new curriculum in geriatric PSDSM program. So therefore, there is a need for that. We should see that what we are supposed to teach to our nursing students. For that, we need to prepare for our nursing faculty so they will be able to teach in a right way to their students. So thanks a lot. Inshallah, we'll keep a continue in future with you. Thank you.
Thank you.
Now I'm delighted to introduce our very young, energetic speaker, Ms. Atika Akram. She is the principal of the Muhammadiyah University, Pakistan. She is going to speak about the practice of geriatric nursing.
ये यंग है
You are so young, so for us you are young.
वो अपने साथ के साथ
अच्छा अच्छा कायदे से यंग है बिल्कुल
I am principal at Muhammadiyah Islamic University, Negia Sharif, from Kashmir. Basically, I am not from Pakistan today. And, basically, I am from Pakistan, but now today I am living in Kashmir. And I live here in the afternoon, 12 o'clock, and we're waiting for this seminar. And first, I have read this subject in my master's degree. I did my MPH from Hazara University, and I did this subject with 3 credit hours. And at that point, I was thinking there is no application in
तस्वीरों वाले बहुत है,
Pakistan,
देखो
but now I
इधर घूम रहे
realize
हैं।
my subject
क्या
was
कर रहे हैं लोग
already introduced to me, and this subject is feasible for me to teach the other persons who are in nursing. And when we talk about geriatric, basically geriatric nursing is the bridge between older people and the nursing care which we have to provide them. And this is the main bridge which we have to achieve now. And when this is part of our curriculum, we can easily implement, and every young nurse is responsible to learn this and to implement this. because older people, because they are senior citizens, and in our home even, we are doing the practices of others. And when we are at the hospital side, why we are not doing this? We are doing this already because we are providing the care those persons who are not treated at home. And now we are going to address this in the form of subject to introduce those things which are not already learned by us. And for a good nurse, for a good geriatric nurse, firstly you have to sit in front of your patient, in front of your senior, in front of your older adults.
कुर्सी
Why?
चाहिए जरा।
Because this will improve your communication and you can easily listen and transfer your knowledge and you can easily achieve your goal of nursing care. Other one is experienced patients. When you are doing your practice in geriatric home or you are treating a old person, a senior person, you can face some problems regarding you have to talk again and again same sentence. You have to tolerate it with patience because they have other opinions, they have life experiences, and you have to understand these experiences. Maybe when we are at this stage, we are all together. We can say you are wrong and I am right, and I have experience of this thing in this way, but now you are telling us wrong way. So always respect your seniors. Always respect your older adults. Seniors is not in a sense of your professional, but in a sense of older people, older adults. Okay.
ओस की हैं।
Show proper respect to them. Listen actively. When you listen actively to those persons, they can easily understand your words, understand what you want from them. If you listen in such a way that you are not paying attention, when they are talking, you are not paying attention, this will make the gap between you and your older people. When you pay attention and listen actively, then your gap will be, generation gap will be removed. And you can achieve your goal of nursing
कुछ
care.
सारे बातें पर
When you are at hospital side,
कुछ नया
patient came to
लिफा
you,
की छाया
and you are the only person
वो
who
नया होगा
can
हमारे
give her all the empty and all her or his concerns. So build a good rapport with your patient. If your rapport is good with your patient, you can implement your all level. Most of the patients refuse you with them, then you can easily introduce all your nursing care plan and your all will be good. And another one point is show sincerity. Don't discuss your patient with others because when we discuss anything to other person at this stage, they feel shy, and other times they don't agree to cooperate with you, and you cannot implement anything. And ensure and recognize sensory challenges and treat our patient according to their needs. We are just introducing this subject because older community is becoming raised, and as my madam Humera already discussed in 2050, 43.3% of your generation will be older adults. So we have to recognize all these things and improve our nursing care for older people. And no doubt, we are living in Pakistan and we are Asian countries. Most of our culture is main responsibility of older people is family. Family is responsible for everything. But the older people are at our bedside, and even at home, we are nurses. We have to provide them the comfort, and we have to provide them those nursing cares which they have to. Then physical comfort, if they have some kind of impairment, don't ask them to walk, don't ask them to move, because if they lost their physical comfort, they cannot cooperate. At this stage, nurse is a advocate for patient. Why? Because he or she can talk on the behalf of patient, with family, with consultant, with all other healthcare professionals. And care provider is also the basic point. You are a care provider, and your care should be flawless. And you have to provide those care skills which our older person requires. As pathophysiology is same, no nothing would be changed, but the requirement may be changed. Requirement at the young stage is different and older age is different. At the young stage, if you have some kind of disease, the young one easily understands your words, easily understands your plan of care, but at the older stage, they cannot easily cooperate to you if you don't have proper nursing care skills. And now I want to close my speak just in one thing: make a bridge between you and your older people to compensate and to fulfill generation gap. Thank you.
पहले डांस भी जब बीच बना दो
ब्रश बना
Thank you, Anika. Yes, we are looking as the age grows, there's a lot of changes come in the body, physiological, psychological, and being a healthcare professional, we do understand this, the changes came in that person, so we have to take care according to that. I remember when I was a very young nurse and one of the very old patients, and I remember that once he called me, I went to him and asked, what's the problem? He said something happened to that problem. Again, after 5 minutes, it again called me. And I think that I remember within a 1 hour, he called me for 14 to 15 times. And at that time, I don't know, he is having a hearing issues. He won't be able to understand. He cannot listen properly. So at that time, I did not realize there was a big issue. And I thought, oh my God, ये तो भाई बड़ा ही irritated लगा है बताते हैं। इसको ये देखा, he is seeing that I'm taking care of 15 patients at a time, and he is not that kind of a person. He is putting me in trouble. If I will not complete my task during my time, definitely my charge must will come and shout on me. So I remember, so now I realize that therefore we are seeing the need for training, education and training in a specialized field. Thank you, Akhtar. Now I'm calling one more motivated and young speaker. Captain retired Elijaz, Principal Islamabad College of Nursing from Pakistan.
चलो ये यंग इसको मान
Dear Madam Geriatric, congratulations for organizing such a wonderful and very much required seminar. So congratulations even to you and the university. And I feel so honored to stand in front of my dean as I am a doctoral student. Ma'am, I'm so honored to stand in front of you. My colleagues, I'm so grateful for your presence, and thank you for giving me this platform to share global perspectives on geriatric nursing. Before starting, I would just like to share that although I am in my 30s, but I know every day one more wrinkle around my eyes is coming, one more gray hair is coming. So it is, I think it is challenging to accept aging, but I used to console myself that accept aging with grace, dignity,
and honor that you are aging. So, and once again, I would also like to share my feelings. And as I was a pediatric nurse initially in my career, so when I used to go to or I was placed in adult wards or especially in ICUs and CCUs, I became very restless. And I didn't know that why it comes to me, why I became very unrestless. So now I realize that I wanted to care the older patients just like the child, the baby. So, and the system, my training, my competencies, they were not enough that I can care them like the older children. And as my my colleague shared that when the aged patients or the population, they often experience dementia and they want attention, they want to be treated like children. So I agree with that, and that was the thing that always made me uncomfortable. That I felt that I'm not competent to care them like a baby. So they are really the kids. They need same attention. They need to be cared. They need to be listened. They need important. So coming towards the global perspectives, as all the international speakers, they highlighted the innovations, needs, and current practice in geriatric nursing. So I will just summarize it in 3 points. First of all, what is there and what are the nursing practices currently are being practiced in the global community. So first of all, our colleagues already shared that the comprehensive geriatric assessment. So as we are going to introduce the new curriculum, it's very important that we understand the needs of our community, of our people, what are their needs. We have system, we have different family support system, our culture is different, so the need of our geriatric population is definitely different. So if we are interested, we are committed to provide care to our geriatric population, we definitely need to see or have a comprehensive geriatric assessment, and we can do this with the researchers, research-based activities, and to understand that what need of our people, and then bring it, and then we can devise a holistic care for our patients and the population, and this will develop or a personalized care. Nurses will be able to develop personalized care plans for the geriatric population, what they need, what are their values, what are their what is the cultural requirement to be considered. So, and with that, there is global practice of providing domestic care and community-based care to the geriatric population. As our hospitals, they are not the place to provide preventive and primary care. So the geriatric population, as we discussed that, except aging with dignity, and gerontology is about the aging with health. So definitely it is the primary care and preventive nursing, and it is need to be considered in the community settings. So this is again area that the world is working on it, and we can also. So, and then the most important practice worldwide is the fall prevention and home modification and strength building exercises and treatment to the elderly population. So this is again the practice that we can bring in to the Pakistan and for our elderly population. And with that, the innovations globally, as my colleagues discussed that, globally there is trend in telehealth and remote monitoring. So we can be benefited from the telehealth services and remote monitoring of our elderly population, where their problems can be tackled in a very advanced stage, and we can prevent the further complications, and this would be very cost economical treatment in terms of healthcare cost, and especially when there is shortage of hospitals, shortage of nurses, trained nurses. So yes, we can be benefited from the telehealth and remote monitoring as the world is getting benefited. And then AI, as AI has not left any area that it is not introduced or hijacked. So robotic care and assistive technology, it is being taken into the healthcare system by the Japan and Canada and China. So these are the countries, those who have included technology in their healthcare system. And Sparrow is a robotic dog that can provide physical and emotional support to the elderly population. They can walk with the patient or the person, and they can touch them and they can feel the warmth of the body. So this kind of innovation we're bringing in the healthcare system, and especially in the geriatric nursing. So the last is the palliative and end of life care. So palliative care, we understand that our elderly population, when they get chronic diseases, they need palliative care. They need somebody to be at their bedside for support, to listen them, and to relieve their pain, to bring ease to their life. So palliative care, and then again here comes the collaboration of multidisciplinary collaboration to enhance the comfort of the patient. And with this, the third point is the global challenges, and we must be aware of global challenges. That is the workforce shortage, and workforce training and capacity building. So again, this is the challenge, and we are facing the same, and we can address it with the educational certificates and the workshops and the programs. And then the bigger challenge, that is the policy and the funding. So again, there is need to desensitize the policy makers to realize that this is the area that we need to invest for our healthy geriatric or older population. And then cultural competence, we give competence to our nurses so that they can understand what are the needs of the family. So they may not be annoyed if there are the demand comes from the family. So they must be aware of that. These are the cultural aspects, and they must be prepared for that, so that they can prevent a compassionate care to the patients and the family. So with this, I would say thank you so much for giving me this platform to share my understanding and the future perspectives we can move forward. Thank you so much.
Thank you for highlighting the important words for the geriatric care. Now I'm calling upon my esteemed speaker, Ms. Asma Mughal, Director, Nursing, Unified Healthcare Services, Nurse Quality and Patient Safety Champion and Lead Auditor in Pakistan. She will talk on mental health and cognitive care for seniors.
Thank you, madam. So, all are well informed, energetic, with us. इतना हल्का यस यार इतने यंग लोग बैठे में जेरियाट्रिक केयर लेने वाले और इतना हल्का यस So, the mental health issues and cognitive care certainly require special attention. That's why we are all here together to discuss the issue and to highlight the challenges and to gain the knowledge from experiences and academic or curriculum activities. So major mental health issues are depression and anxiety, changes in sleep pattern, dementia, Alzheimer's. Schizophrenia, most of the mental health issues and cognitive care discussed, but I am only elaborating the cognitive care actions what we have in our daily life for our seniors at our home or at our hospital. So, memory care program which includes stimulate cognitive skills and social engagement in a safe environment, medication management, physical exercises like swimming, walking, chair exercises, nutrition about proper health and about fruits, vegetables, medications, and social interactions, which contributes sorry, group outings, volunteer opportunities, and foster connections and combat loneliness. So, cognitive care also include the cognitive behavioral therapy.
फॉन्ट साइज इन्हें बड़ा रखो 16 18 तो पे जो
Cognitive behavioral therapy, reminiscence therapy, art therapy, beneficial for seniors dealing with mental health issues and cognitive decline. Caregiver supports and regular health monitoring programs which addressing mental health issues and cognitive care with a holistic approach that considers physical, emotional and factors which can help senior citizens maintain their well-being and quality of life as they age. It's all by my side. I think you are most experienced and already involved in the care of geriatric. So limited and sour and sweet message from our side. Enjoy the event, enjoy the seminar.
थैंक यू ओके
तो बॉयज का यूनिफॉर्म ज़्यादा अच्छा
हाँ
वाइट पैंट
Thank you, Asma. Mashallah, you gave a
Principal
very
uniform
concise,
देते हैं
very concise presentation and conveyed a message. It's very, very important. This cognitive care is very, very important. And now, calling upon one of my loving, very disciplined
या
teacher, mentor, facilitator. I think there are very few people in my life who really showed me a path that where I am at. So I am calling a professor and dean faculty of nursing and midwifery, Shifa Tamir University of Pakistan, Dr. Ray Sagar.
ये शेयर कीजिएगा
मैडम के कहना डॉक्टर रेखा कहते मुझे याद है कुछ याद है वो मेरे जो स्टूडेंट्स सब बैठे रहे ना वो कहते हैं कि मैडम आप बहुत डिसिप्लिन है आप बहुत स्ट्रिक्ट है तो सी माय टीचर क्लिनिकल इंस्ट्रक्शन Thank you. I'm very humbled and honored to be called here. मुझे exactly नहीं पता कि क्या टास्क मुझे दिया जा रहा है, but I would like to congratulate you. As others have said, it's a very, very important topic, and I want to confess something also to all of you. As you have already mentioned, and also somebody else also mentioned, I think Farhana mentioned, that the geriatric nursing course has been included in the revised curriculum of ESCN. But the confession that I'm making, it was not on the basis of that, we have to prepare ourselves. It was rather that several nurses who went abroad and they used to ask me to give them a certificate or to write for them that they have provided care or they have done a course in geriatrics. And as you all know, my principles, I found it very hard because I knew that we are not providing them any course in geriatric. Yes, when they are caring in medical surgical units, they have the opportunity to care for. But one thing is caring for someone without preparation and knowing it all and providing holistic care, these are two different things. So that was the reason that when I had the opportunity recently as a convener
for the revision of curriculum at national level, I advocated to include this course. And it has been included, that is I think in the third or fourth year now, I don't remember because I also qualified, in that group of geriatrics, so, memory is not that sharp. So, but what we are going to do to start this course in summer, inshallah, so we can even join hands. And I think I thoroughly enjoyed what I had, talk about two quick things. I didn't know anything about geriatric, but when I was a young nurse, somehow, when I used to see people dying in the hospital, and the way they were. So I had promised to myself that I would not allow my mother to die in hospital. So when she was, at that stage, that, she's not doing that well because she had a stroke. So I came back and straight away from the airport, I went to the hospital, I made arrangements, and I was the luckiest one because I had a lot of support from Aga Khan University. So I made arrangement for her, and the last 3 weeks of her life, she spent at home. And because we knew what she likes. In the hospital, it's very difficult. You can't. It's not fault of the hospital also, but either our system structure, and also because of the everything there. So at home, she was on her own bed. I called, all my sisters with their children. I, turns, and they sit with grandma, and they, so that was something, the family was at comfort as we were preparing for her death. As you know, we look forward to receive the newborn. I think it's the same. We all know that we have to go, so it has to be in a manner which is peaceful, which is comforting, rather than at the time of death in the hospital, you may have only one person be allowed, and even sometimes when the nurses are not that competent or understanding the need of the family, even that one person is not allowed. So that is something that is my personal experience, because it was mentioned there, the end of life here. So I think that is something that families should be prepared. And I would also say that the family support that we have in Pakistan, we need to utilize it. We talked about preparing nurses, but I think we also enable families how to care for their elderly, and I'm sure there will be many people who will be willing if we offer some courses for the family to understand. And allow me to say something in Urdu, कि शायद जो बहुत ज़्यादा सास बहू के झगड़े हैं वो भी कंट्रोल हो जाएंगे अगर थोड़ी सी हम उन बहुओं को भी बता दें कि हाँ बाकी मेमोरी लॉस होता है, बाकी कुछ इशू होते हैं, इनकॉन्टिनेंस के जो इशू होते हैं, ठीक है, because they don't know, and how the self-image is disturbed, when they have all the autonomy and everything, and when they lose everything, and so, a lot. So the point is to help the family, and many, people, I would say the young people, they may not have the time, but if children are there, and again I remember my mother, that how pleased she was when I was moving to Canada for my studies, and I asked my niece to be there, and she had a young daughter, and then she used to play with the dolls, So again, we can be very creative in our thinking that how elderly people can be helped, and how they can be respected And my last point is that understanding that more than anything, the importance of your presence. So my last memory, remember when, who was a senior citizen, and she used to call me almost, every 10 minutes. She used to, give a bell, and when I went there, she said, "Love, I want to go to the loo." And I would take her, and then she will be sitting there, and she will be saying, "No, there is nothing." So then I used to, take her back. And when it happened, I think 5 or 6 times, so there was some irritation in my behavior. And then she just folded my hand and she said, "Love, I am feeling lonely. So, if you could spend some time." So I think understanding that what their needs are.
You really put up very important points because since we started, we are talking about the healthcare profession. But we are very fortunate that we are living in that culture, in the Islamic perspective, as well as the culture perspectives. So thank you so much, Dr. Vanessa, for having a very good contribution. And I agree that we will. And also she was awarded Presidential Pride of Performance by the government of Pakistan. Please join hands together for Madam Claire Pasha, former Principal CUN.
ये जेरियाट्रिक जेरियाट्रिक है जेरियाट्रिक अल्जीमर पार्किंसन सब कुछ
In the name of merciful God, I am grateful for this age. And you have to guess my age. I won't tell you, but you already said it, right?
1 or 10
So it's all right. I will have my birthday on the 15th of June. So I will be 83. I'm blessed. So you are now facing a person who really has been and who will be, and I never say, I'm still young. And I will prefer tell you all that you be active in your service. Number one, prayer, your belief in God, work hard, be honest, and share your knowledge, whatever you have, till the end. Okay. We have already mentioned the same sentence. You have heard so many things, so I will just go very quickly. It's almost the same what all the speakers have said since afternoon. So I'll go quick and let's see if you have any questions. Please go ahead at the end, and it will be very quick.
खत्म लग रहे
देखो technology को release. So I will practice everything whatever is existing in everything. Okay, sorry. Okay. Please go on. वैसे मैं ऊंचा बहुत बोली I speak loud, so loudspeaker desired or not?
yes
Okay, thank you. Just go over it and we'll be quick. Yes, next please. Duties.
monitoring assessing investigating
Therapies.
psychotherapy, spiritual therapy, musical therapy,
passing on quickly,
aromatherapy.
right?
बाबा दाढ़ी वाला दिन
And it's a big, so it's visible to everybody. Yes, next please.
हम वहाँ गिटार लेके जाए तो
Safety measures. I saw it for the first time. I met a friend of mine from Holy Family since 1998. So I met her after 60 years. And she sent me a picture the other day. And she said, Clara, I wish we had all these things when we used to raise the patients from the chair onto the bed. And now they have all these devices to be making them comfortable. So those devices have come in. Yes? There you are. Okay. Lifting up the patients. Down. Easy. Easy, are they? Well, when I was teaching in the School of Nursing in BBC Hospital, it was Central Government Hospital in 1966, and I had very, very bad backache because it was lifting up the heavy patient. So I was in bed for
body mechanics.
You have already mentioned all these diseases, common chronic conditions existing in the elderly. And the best 7 old age homes in Pakistan. Can you recognize the first one? Okay, the years are there. And imagine she was helper
और
or
सुकून
nurse,
छिपा
Mrs.
एहसास
स्टोरी तो सबको पता है।
काफी
और
है।
जब 20 साल पर मुश्किलात आई और लोगों ने कुछ कहा, तो जापान ने कहा कि अपना एक ही मुझे दे दो, मुझे दे दो। ये मालूम है आपको? Thank you. जी, Darul Salam, Darul Sakoon,
शुक्र है
and so forth.
Thank you.
This one I have seen myself. 3 of these I have been to them, to these houses. I had the pictures, but I just excluded. Next please. Next one. Oh. I have one picture I want to show. Thank you very much. We used to go and practice our midwifery skills on bicycles in Rawalpindi Separate Town, Rawal Dam, and those 5 deliveries, we really went on campus and the bicycle. So I expected it
एक और भी था
दो हैं वो बेटी पर देखते हैं मैं 2 बेटी
इसमें एक की बहुत
उसमें से दे दें अटैच करने वाले इसमें मेरी मदद की है लोगों ने मेरी स्पेस स्टूडेंट रही और मेरी फैकल्टी मेंबर रही हैं जरीना थैंक यू दैट्स व्हाई वी आर ऑल टुगेदर स्टिल वर्किंग encouraging and you might have one more
व्हाट्सएप फोन पे
old age home one day that's my wish as I said in my PhD
मैडम का पूरा व्हाट्सएप अभी आपको
काश पैसे बहुत होते तो मैं तो नहीं लेकिन एक छोटा सा होम खोल तो इसमें आपकी सहूलियत एज स्टेक